So, good morning class. Today let us learn urinary tract infection. Okay. So, objectives of today's lecture are, we will discuss about the terminology used in urinary tract infection. We will define the urinary tract infection. We will also discuss about the epidemiology, risk factor, pathogenesis, clinical feature, investigation and treatment of urinary tract infection. Okay. So, terminologies. So, urinary tract encompasses the two conditions. Urinary tract encompasses the two conditions. One is asymptomatic bacteriuria or short form ABU, asymptomatic bacteriuria, and second one is symptomatic UTI, Okay. So, asymptomatic bacteriuria is a condition where in urinal analysis we see the WBC, and even in culture there is a growth of organism, but patient do not have any symptoms. Such condition is called asymptomatic bacteriuria, whereas symptomatic UTI is UTI where there is a symptoms of UTI. Okay. And symptomatic UTI basically is of three types. One is pyelonephritis, second one is cystitis, and third one is prostatitis. So, pyelonephritis is the infection of renal parenchyma, okay, and cystitis is the infection of urinary bladder, and the prostatitis is a infection of prostate that occurs in male. Okay, so cystitis is bladder infection, pyelonephritis is kidney parenchyma infection. Okay. So, these are the terminologies. So, other terminologies we use to define the UTI are like uncomplicated UTI. What is uncomplicated UTI and what is complicated UTI? What is complicated UTI? So, uncomplicated UTI is UTI in, there are three kinds: non-pregnant woman with no surgery, no intervention. And no immunocompromised status. Status and no structural change. So, uncomplicated UTI is UTI occur in non-pregnant women who do not have any immunocompromised status, any structural changes in the kidney and the bladder, and there is no history of any intervention like Foley's catheterization. That is uncomplicated UTI, and complicated UTI is a UTI occurring in male patient, pregnant patient, immunocompromised patient with some intervention and the immunocompromised status. Like if someone has UTI and has also the diabetes, that is complicated UTI. If someone has UTI after putting the Foley's catheter, then that is UTI. If UTI occur in pregnant female, then that is also complicated UTI. So, these are the definition and the terminologies which you used while defining the urinary tract infection. Okay. Now, what is the epidemiology? Epidemiology wise, so epidemiology wise, UTI, when you think or when you read about UTI, UTI is a condition that occurs predominantly in female. Most of the time we get female patient, but in case of infant, and after 50 years, even in this age group, UTI can occur in male, and it also shows the slight male predominance in this age group, because the structural abnormalities like vesicoureteric reflux, which predisposed to have UTI, occur more commonly in male. That is why in an infant, like the cause of the UTI may be the vesicoureteric reflux, and similarly after 50 years, like as the size of the prostate goes on increasing, it increases the chances of UTI as well. That is why in this age group, even the male have UTI. Okay. Then so UTI in other, like from infancy to up to the 50 years, UTI occurs predominantly in female, and around 50 to 80% of the female have one episode of UTI in their lifetime. So UTI is very common conditions. We admit it, we see so many cases of UTI in OPD. Okay. Then what are the risk factor of the UTI? So what are the risk factor of UTI? So risk factor of UTI is past history of UTI. If someone has the UTI, then that predisposed to have another episodes of UTI. Second risk factors for the UTI are what? Like immunocompromised status, like diabetes, they are more prone. Like patients who are taking the immunosuppressives, they are more prone to have UTI. Similarly, like in a patient like postmenopausal status patient have, like they have more risk to have UTI because of the dry vagina, which can be frequently colonized with the uropathogens. Another important is frequent sexual intercourse is important risk factor for the UTI. If a young female has the UTI, the cause may be the sexual intercourse for that thing. Okay. Then instrumentation is important risk factor. If you do the Foley's catheterization, that is the important risk factor to have UTI. And any structural change in the genitourinary tract. So any structural change, like if someone has this polycyst in the kidney, so these person have more risk to have UTI. Similarly, reflux or stone or mass or prostate, so they have more risks to have the UTI. So these are the risk factors for the UTI. So what is the pathogenesis? It's bit complicated, but let us define the pathogenesis as per the epidemiological pride. In the epidemiology, there is something called host, there is something called agent, and there is something called environment. So agent is like different organism like the common organism that cause the UTI is E. coli. Other are the gram negative rods like Klebsiella, Pseudomonas. So these are the common organism that cause the UTI. So, okay, agents. So agents, they have the fimbriae, like E. coli has the fimbriae which can attach with the urinary tract. So this characteristic of the E. coli like make them able to infect the urinary tract. So agent. So environment wise, like some of the person has the favorable environment for these organisms like E. coli or Klebsiella. What are those favorable environment? Like if someone has the Foley catheter, then that's the favorable environment, Foley's catheter, or urinary retention, like in a patient with BPH or UV prolapse, they have Foley's catheter, urinary stones. So if the environment, like if the bladder has retains son of urine, or bladder has stones, or kidney has stones, or there is a Foley's, these environment is favorable for the transmission and the growth of this organism. Okay. Similarly, host factors, there are complicated host factor, but there is some genetic component. If the mother has the UTI, then daughter have more chance to have the UTI because there is certain genetic component. Similarly, past history of UTI. If someone has the UTI, then that makes prone for another UTI. Okay, so you have to just write something about the agent, environment and host, and there is interplay between these factors to have urinary tract infection. Okay. Then let us discuss about the clinical features. So let us discuss about the clinical feature. Let us discuss about the clinical feature. Let us discuss about the clinical feature. In the clinical feature, we will go one by one. Like in case of cystitis, what will happen? In case of cystitis, in case of pyelonephritis, and in case of prostatitis. So the important clinical feature of the cystitis are, like if someone has the bladder infection, the important clinical feature are increase in frequency of the urine, and urgency and dysuria. So these are the important clinical feature. If someone has the bladder infection, they will have the frequency, like they want to micturate more frequently than previous days. Similarly, they have urgency, they can't like retain the urine and they have to go immediately once there is a urge to urinate, and they have also the painful micturation. So these are the tried for the cystitis, and some patient may have the suprapubic discomfort as well. Let's suppose if a female comes to me and say, doctor, I have like increased frequency of micturation, I have burning micturation, then definitely I will suspect cystitis in that female. Okay. So in pyelonephritis, the important clinical pictures are, important is fever and the flanking. Most of the time I have got these two symptoms. One is fever, another is the flank pain. Like if my right kidney is infected, then I will have the flank in the right flank pain. If my left kidney is infected, then I will have the left flank pain. Okay, but fever of the pyelonephritis is of typical type, picket fence type, picket fence, like this type of fever. Okay, this type of fever. So this is the febrile period, this is the afebrile period, this is febrile period, this is the afebrile period, this is febrile period, this is that. This is picket fence. This is called picket fence type of fever. Picket fence, picket fence, picket fence, like picket fence. Okay. So if we have a pyelonephritis, then we will have a like fever of, we associate chills and rigor, like there will be the chills and there will be the rigor, and fever can go up to the 103, 104. But it occurs for 15 to 30 minutes, then it will go, and like you will have a febrile period, then again after a few hours, then you will have another episodes of fever. So this is picket fence type of fever, and usually responds to the antibiotic within 72 hours of its use. Okay, this is a very typical characteristic feature of the pyelonephritis. Whereas prostatitis can present with a feature like the cystitis, but other than this, prostatitis patient may have the pelvic pain in the perineal or pelvic pain. You know what is pelvic or perineal pain. So you will have the perineal pain one, and you can have also the feature of bladder outlet obstruction. Like there can be a retention of the urine. There can be the history like of the straining for the urine, and patient will have the pelvic pain. So if someone has that, then prostatitis, and they can have even high grade fever, they can have the low grade fever. Okay, especially in male, especially in the male. So these are the clinical picture of the prostatitis, cystitis, and the pyelonephritis. Okay, then let us go to the investigations. So what are the tests? Other than the other routine examination, we need 3 tests. One is deep-stick test, one is deep-stick test, another one is urinary, and another one is urine culture. These 3 tests helps us in diagnosis, and sometimes ultrasound. Okay, but these are the main tests are the deep-stick, urinary, and urine CS. Even deep-stick tests can detect the UTI. So what does deep-stick shows? Enterobacteriaceae organism can be detected by this deep-stick, but it has definitely false positivity and false negativity, because Enterobacteriaceae can convert to nitrate to nitrite, and it can be seen in the deep-stick test. So some organism can be detected by the deep-stick test. Similarly, in urinary, what you can do, you can see the WBC. Usually more than 5 WBC per high fire field is significant, and we take that as UTI. And okay, UTI. So these are the point of care test. When patient comes, and the report of this test can come immediately. Urinary and deep-stick. In urinary, sometimes you can see the RBC, sometimes you can see the albumin. Like these are the other findings that you can get in a patient with UTI. But the important test, that the gold standard test, is urine culture, because on doing the culture you can grow the organism. If organism, you see the organism, then that's the UTI. So in case of symptomatic female, we take the value 10 to the power 2 bacteria per ml of urine. In case of male, we take the value 10 to the power 3 per ml. Previously it was 10 to the power 5. So if someone is symptomatic and female, so when we are doing the culture, if there is a 10 to the power 2 per ml, then that is suggesting of the UTI. If in case of female, we take that value 10 to the power 3. Okay. So this is the test. Why I have written the ultrasound? Because in some of the time, when you do the ultrasound in a patient with pyelonephritis, then like there can be the altered ecotexture of the kidney, and even kidney size may increase. Other finding that can be given ultrasound is that if there is a stone, then can be detected by ultrasound. Okay. So main tests are dipstick, urinary, and the urine culture, that we have to know. So what are the things we have learned till now? So UTI is of two types. One is the asymptomatic bacteriuria where there is no symptoms. Another one is symptomatic, that is prostatitis, cystitis and pyelonephritis. You know what is that thing. We have also learned about the epidemiology and risk factor of UTI pathogenesis. In the clinical picture, if there is a fever and flank pain, that suggests the pyelonephritis. If there is a feature of increase in frequency, dysuria, and then the urgency, that suggests cystitis. In addition to that, if someone has the pelvic pain, especially male, then that may be suggestive of the prostatitis. Three important tests we need: urinary, dipstick test and the urine culture. Urinary and dipstick are point of care test, whereas urine culture requires some time to give the report. Okay, to give the report. Now treatment, how we treat the patient, So we should not wait for the culture report to treat the patient if we have a strong suspicion for the UTI, especially in female. Now if someone has the cystitis, then what we give? The important drug you use is the nitrofurantoin. Nitrofurantoin is the important drug. Nitrofurantoin. It is used in 100 mg BD dose and for 5 to 7 days duration. Is very important drug. Other drug we can use is the trimethoprim, TMF sulfamethoxazole, double strength, that is a BD for 3 days. Another drug what we can use is the sometimes we can also use the fluoroquinolones, different fluoroquinolones for 5 to 7 days. You can use levofloxacin, ciprofloxacin. Yes, these are the fluoroquinolones we can use, but the common antibiotic that we use in a patient with cystitis is nitrofurantoin, and it is one of the antibiotic, is one of the cheap antibiotic. It is one of the antibiotic against which the resistance is not like the organism cannot develop the resistance easily. So now we use the nitrofurantoin, though it have its own side effect. Okay, for 5 to 7 days. Okay, nitrofurantoin. Similarly, in case of pyelonephritis, what you use? In case of pyelonephritis, we can use the fluoroquinolones. Fluoroquinolones we can use fluoroquinolones. So why we don't use nitrofurantoin in pyelonephritis? One of the mistakes people are doing are they are using the nitrofurantoin in a patient who have high grade fever and the flank pain. In a pyelonephritis, nitrofurantoin can't work because nitrofurantoin cannot invade the renal parenchyma. Okay, so do not use nitrofurantoin in pyelonephritis. The first line drug we use is fluoroquinolones like levofloxacin or ciprofloxacin, but not moxifloxacin. We use ciprofloxacin and the levofloxacin. Okay, for near about 7 days. For near about 7 days we can use. You can try the TMF and sulfamethoxazole in you can go cephalosporin like ceftriaxone or cefixime you can use. So these are the common antibiotic that we use in a patient with pyelonephritis. In a patient with complicated pyelonephritis, like who had already history of pyelonephritis, who had stones, who have cysts, then in that case we often use the beta-lactamase inhibitor combination like piperacillin and tazobactam, like ampicillin and sulbactam. These are the antibiotic we use in that condition, and we often use the imipenem celestine in a patient with complicated pyelonephritis. Okay, in a patient with complicated pyelonephritis, these are the second line drug. So in case of the prostatitis, we use the antibiotics not for 1 week, for minimum for 2 to 4 weeks in case of acute prostatitis, and in case of chronic prostatitis 4 to 6 weeks. We have to give the long duration of the antibiotics. In case of the prostatitis, you can use the drugs like fluoroquinolones, you can use the drugs like TMF sulfamethoxazole combination, but remember we have to give for the long duration, that is 2 to 4 weeks in acute and 4 to 6 in chronic. Okay. So, one important question that people can ask you, if pregnant female have UTI, then what antibiotics? You can use 3 antibiotics in that situation. One is nitrofurantoin you can use ampicillin, and you can use cephalosporin. 3 antibiotics you can use. We are not using the TMF sulfamethoxazole combination because it has the phytotoxic effect. Similarly, not fluoroquinolones, because fluoroquinolones have the bad effect over the fetal cartilage. So, we do not use fluoroquinolones. Okay. So, in pregnant we use usually nitrofurantoin, ampicillin or cephalosporin. So, there are some other issues which are the out of scope for this today's discussion. So, the take home message is UTI is an asymptomatic bacteriuria and symptomatic, and there is pyelonephritis, cystitis and prostatitis. These have the different presentations. 3 important tests are there: depistic urinary urine culture, and antibiotic nitrofurantoin for cystitis, fluoroquinolones for the pyelonephritis, and prostatitis the antibiotics like fluoroquinolones or TMF sulfamethoxazole for the long duration, that you have to understand. In case of female, you can use nitrofurantoin or ampicillin. Thank you so much for your attention. If you have any comment, then you can write in the comment section. Okay, thank you.